Okay, here we have Barb, and just about 12 months ago, we decided to do some laser stem cell signaling. She had some osteoarthritis in her knee. We just only did the left knee, correct? Did we do both?
Oh, you did the left and the right.
Oh yeah, we did the left and right. So
Yeah,
yeah. So
mostly
1 year
the
later, Barb, how are the knees holding up?
well, the right knee is holding up 100%. I have had no problems
Okay.
and no swelling as far as I can tell. But the left knee, I still have swelling, and I've had some treatments on that. But and so it goes down. I had 100% recovery on that until about a month ago.
Okay.
And I have a little bit more pain on the outside of the left knee, especially when I try to go down steps.
Okay.
Yeah, and walking, I can still walk
Okay.
without problem for a couple of miles, but it's mainly bending. It's mainly the bending. I
Okay.
was trying to
So the right knee's still 100%. A year later, the left
100%,
knee was 100% up until a month ago, right? Okay.
right.
And then it started getting a little pain and the swelling came back a little, but considering the left knee, it did last the 100% relief for 11 months. Now that it's been a year, it's not like it was back to square one, right? It's still doing really good.
It's still, no, it's like 90% now.
Okay,
still.
I'll take
it's
that.
Still really good, yes.
Yeah. So sometimes
I can walk. But
yeah, that's why we do the yearly follow-up. We want to make sure this is long-term. So we'll discuss perhaps the possibility of doing a booster injection just for the left knee, just to keep the progress going so it doesn't go backwards. We have a new device where we don't even have to use donated stem cells. We could use your own blood. It's called platelet-rich plasma, but it's in a high super concentrated dose. And we count your platelets, and then platelets is the first molecule that goes to the site of injury or inflammation, like your knee. But if you have a low platelet count, then it's not going to repair in a long-term fashion. So, because the platelets, after they seal a wound, after you get cut and make a scab, they signal your skin stem cells to come repair. So your platelets may have worn out after a year, along with the cell signaling. So we'll talk about like perhaps doing a booster of that, and that way it'll be long-term. Okay. All right.
Okay. Will it be long-term after that? Usually
definitely, because this is new technology, and we after we count your platelets, we know the exact dose of platelets to regenerate that knee, for long-term. And it's your own blood, which is perfect. All right. So we'll go ahead and discuss that. But I'm glad that the left knee is still 90% better. The right is 100%. I'll take those. Could you show me your mobility? Go ahead and stand up. Could you stand up for me? And then.
Yeah, I've got all my stuff in my lap.
And go ahead and walk across the hall and come back. All right.
Oh, okay.
And come on back. And then I want you to do like a squat. How far could you bend down without any knee issues? You could grab the table if you need to. Yeah.
Well, I can bend down this far, but then I can't bend anymore.
Okay, but that's a lot better than last year anyways, right?
Oh, right. Well, now on the right knee, I can get all the way down to the floor. And so that way I can then help the other.
I think we'll definitely have to do the booster, just because although you're 90% of the pain, we want more flexibility and strength in that left knee. So we'll go ahead and discuss that. All right.
Yeah. Okay.
All right, we'll go from there.